You say I ain't got what you need to be by your side.
The idea of social contract in and of itself is fascinating. I mean, of course, as a French person, I think of Rousseau, and it's this idea that we as citizens accept to give up and to give responsibility to someone to rule us, so that they would, in exchange, basically ensure a certain level of well-being.
We know that the existing framework is not enough to cover the big gaps in equity that are producing the lack of health, the access to health. If in the past we were looking for how the distance was in between the north and the south, now what we are focusing on is that the differences are in countries.
The question when we talk about global social contracts, in the absence of a global government, in the absence of global mechanism, is really how will we make this contract real?
To me, the social contract is there is a right, there is a fundamental right to be attended, there is a fundamental right for any citizen living in our country or living in our planet for a basic health attention, and therefore the money should be found wherever it is.
It is clear that we have a responsibility to our fellow humans wherever they live in the world, for all sorts of reasons. I think we should always, when we look at this, ask ourselves what would happen if we were them. I think there are lots of arguments ranging from the selfish to the altruistic, but they all come down to the same thing. We have a responsibility.
I say, baby, what you gonna